Well, the health care protections, the conscience protections, rest on 3 laws currently. And the proposed bill, the health care reform bill, will actually eliminate and undercut those laws so that physicians will not have an adequate protection for their right to refuse to participate in abortion or euthanasia. And that's our big concern. That's one of our big concerns. The other big concern we have with the health care bill is that it funds abortions, which are not medical procedures. Abortions are not designed to increase the health of anyone. They're designed to deliver a dead baby.
Well, I think because of the great uproar from folks that are around the country, I think that it has caused the administration and particularly the Democrats to pull back and to re-examine some of the provisions within that bill. Hopefully, we in the pro-life community have made enough noise and will continue to make our points specifically about our apprehensions regarding this bill.
What do you think about that? Well, I think it shows the intent of the drafters of this legislation, that there is an intent to include abortion in the services rendered, and they don't want to show that intent to the public, but it's there. Therefore, we're going to have to be extra vigilant to make sure that abortion is not funded.
If, as an OB-GYN, I'm concerned about a woman's life, I will put her in the hospital under intensive care and scrutiny and deliver her baby by C-section or hysterotomy. Even if the baby doesn't make it and the baby dies, the intent is not to kill the baby. But in abortion, the intent and purpose of the procedure is to kill the baby. The product of an abortion is a dead baby. So that takes it out of healthcare and puts it into commerce. Yes, a medical procedure is performed. Yes, she undergoes a DNC or a DNE or a DNX or a partial birth abortion. But the intent is not to save anyone's life. The intent is to produce a dead baby.
The black population experiencing a genocidal attack by abortionists. But I think in D.C. specifically, what you're running the risk of is having negative growth within the black community. You're wiping out perhaps the next person who, like Charles Drew, the black man that came up with blood plasma, that next scientific breakthrough originator might not be born, might be terminated. The next Nat King Cole, or even a Michael Jackson.
However, I have at least heard a few things regarding the particular bill that suggests that they might look more, instead of at the single-payer option, of looking at co-ops, which is an interesting idea. I know that there are a few of those that exist around the country. I think that that principally is a better approach, where you actually would have organizations that would be able to have members, and it's not government-run. The questions would be, again, though, what type of incentives do they provide under those programs? For instance, would the NEA or Planned Parenthood as organizations be able to, operate these co-ops that would provide that, and then the government still gives them the $350 or $360 million every year to kind of do what they want to do. So I'm hopeful, but there are certainly reasons that we should be skeptical. One of the things I learned when first coming to Washington was, if there's something that you have that's unpopular, give it a nice name and try to sneak it under the radar. And I think that speaks to your point about provisions that don't specifically say on the face of the bill abortion or euthanasia, but most people who are here in Washington certainly know that with this administration, those are things that they are going to try to protect, particularly because those are the people that looked out for the president in his election. So.
We have a fairly good health system right now, but if we removed a large percentage of the doctors who are in medicine right now, wouldn't that slow things down and cause a big stir in the community as far as who can be served and when and how quickly?
Well, it's not only just a stir. You would actually deny health care to the women who need it the most. You would deny health care to the people who are currently in an underserved area, who currently have great difficulty accessing medical care, because you're eliminating the physicians who care enough about those patients to work there. And that's unethical.